HPV vaccination is cancer prevention.
Definition of HPV is a viral infection that passes between people through skin-to-skin contact. There are 100 variations of HPV, more than 40 of which are passed through sexual contact and can affect your genitals, mouth, or throat. Bacterial. HPV stands for human papillomavirus. How common is HPV? HPV is a very common STD, with an estimated 80% of sexually active people contracting it at some point in their lives. 14 million new infections occur yearly in the United States. About 79 million people, men and women, are thought to have an active HPV infection at any given time. Most people in their teens and early 20s are affected by HPV. Current trend related to HPV. HPV is known cause of cervical cancer, as well as some vulvar, vaginal, pineal, and anal cancers. HPV DNA has been determined through special studies and found in 91% of cervical, 91% of anal, 95% of vaginal, 69% of vulvar, and 63% of pineal cancers. Based on data from 2011 to 2015, about 42,700 HPV-associated cancers occur in the United States each year, about 24,400 among women and 18,300 among men.
How is HPV contracted? Spread intimately through skin-to-skin contact with someone who had the virus. Signs and symptoms of HPV. Common warts, flat warts, plantar warts. How can you get tested for HPV? Females can be tested with the Pap test, where the doctors will take the sample of cells from the cervix. If abnormal cells are found, the doctor usually will do another Pap test and a cervical HPV test. None currently for men, since men don't have a cervix. What are the complications of HPV on the body? HPV can not only cause genital warts, but can also lead to cancer. Around 70% of people with oropharyngeal cancer may have to do with HPV.
Treatment. Warts often go away without treatment, especially in children. However, there is no cure for the virus, so they can reappear in the same place or other places. Medications to eliminate the warts are typically applied directly to the lesion and usually take many applications before they're successful. Examples are salicylic acid, Aldera, Zyclara, and Podoflaxo. If the medications don't work, your doctor may suggest removing the wart a surgical way or another procedure. Examples are freezing with liquid nitrogen, burning with electrical current, or laser surgery. Prevention. It is recommended to get the HPV vaccine and encourage your partner to do the same. Use condoms and/or dental dams every time you have vaginal, anal, or oral sex. Safer sex can lower your chances of getting HPV. If you are pregnant, you're most likely to get a genital HPV infection from vaginal or anal intercourse. In most cases, HPV will not affect the developing baby, nor does HPV infection. These can manifest themselves as genital warts or abnormal pap smears, usually just change the way a woman is cared for during the pregnancy. And though it is uncommon, a mother can transmit HPV to her baby during birth. It is important to let your obstetrician know if you have an HPV. Social implications. Testing positive for HPV was associated with the adverse social and psychological consequences, relating primarily to the sexually transmitted nature of the virus and its link to cervical cancer. Other information and short-term and long-term effects. About 10% of the women with high-risk HPV are at risk for cervical cancer. In a small number of women, HPV will cause changes in cervical cells that can eventually lead to cancer. In young men, the actual risk posed by infection with the high-risk type is very low. HPV-related cancers are rare among men. There's currently no cure for the HPV infection for those people whose immune systems cannot eliminate the virus on its own. Researchers believe that cervical cancer is directly related to the human papillomavirus. About 1 in 1,000 Canadians are diagnosed with anal cancer each year. There are special cases where the risk posed by HPV may be higher. This occurs when a person's immune system is compromised, for example, by co-infection with human immune deficiency virus, HIV.